What happens when the coronary artery gets blocked? Well, the heart muscle loses oxygen and dies. But what exactly is happening in the heart that causes these processes to occur? In this video, I will show you step by step the disease process of a heart attack. Some people wrongly assume that a heart attack and a cardiac arrest are the same thing, but they are not the same. A heart attack is a circulatory problem and a cardiac arrest is an electrical problem. In heart attack, the heart might still continue beating, but in cardiac arrest, the heart totally stops beating. A heart attack can cause a cardiac arrest, but a cardiac arrest does not lead to a heart attack. But in this video, we are going to be focusing on a heart attack. So let's look at the normal. So the heart is a muscular pumping organ and it's made up of three layers. We have the epicardium, which is the outer layer. We have the endocardium, which is the inner layer, and the myocardium, which is the middle layer. Now, once you hear about a heart attack or myocardial infarction, it pertains or it affects the myocardium. The myocardium is a muscular layer and it's made up of cardiac muscles. It is responsible for pumping blood. So when you think of the heart as an organ that pumps blood, the reason that the heart is able to pump that blood is simply because of the existence of myocardium. The myocardium is supplied blood by the coronary artery. You know that every single entity in the body requires blood to be able to function effectively because it is in the blood that oxygen and nutrients are carried. So the blood gets to the myocardium through the coronary artery. So when next you hear about coronary artery, remember to think of it as the artery that supplies blood to the heart. A heart attack, also known as a myocardial infarction, is what happens when blood flow to the heart is either totally blocked or severely reduced. The most common cause of a heart attack is atherosclerosis. In atherosclerosis, there is formation of a plaque which continues to grow until it ruptures and triggers formation of a blood clot that occludes the blood vessel. We have a video on the channel that details explanation of atherosclerosis. Kindly check that out if you are looking to learn more about atherosclerosis. A small number of cases is caused by things like embolism, which could be either a mass of blood or tumor or fat or air that can occlude the coronary artery, restricting or blocking blood flow. We also have coronary artery spasm, where there is a sudden tightness in the coronary artery. This sudden tightness can make the coronary artery snap shut, and that would obstruct blood flow. And then we have spontaneous coronary artery dissection, where there is a tear in the coronary artery. This tear causes blood to flow outside the artery and which will now cause a clot. The clot obstructs the blood flow, leading to a heart attack. These only cause about 10%, which is very little, of cases of heart attack. So in today's pathophysiology, we will be using atherosclerosis because that is the most common cause. Regardless of the cause, the mechanism is the same in heart attack. Remember that in pathophysiology, you simply need to pick a cause, link it to the mechanism through which the symptoms are produced, and link it to a complication. That is just how to say a pathophysiology. So when we come to a heart attack, regardless of what causes it, it causes restriction of blood flow or obstruction of blood flow. This leads to lack of oxygen, causing ischemia. If this is not corrected in a couple of minutes, that is very quickly, it causes the cells, the heart muscles, to start dying. The main cause of a heart attack starts years before. It doesn't just come suddenly, and it starts with a condition known as atherosclerosis. In atherosclerosis, fatty deposits build up on the walls of the coronary artery. So as these fatty deposits build up, they are called a plaque. The main moment of a heart attack happens when this plaque ruptures. As it ruptures, it releases its content into the blood vessel. Now the body sees this as an injury to the blood vessel and tries to stop the bleeding. In trying to stop the bleeding, platelets rush to this point of injury and they start to form a blood clot. This is what naturally happens when you injure. Like when you have an injury on your skin, your body tries to stop the bleeding by forming a blood clot. The same thing is what the body is trying to do in the blood vessel. Unfortunately for the body, its good intention results to a bigger problem because this blood clot is now what blocks the coronary artery. Now remember, the coronary artery is what supplies blood to the myocardium or the heart muscle. Once this occlusion occurs, both oxygen and blood can no longer reach the heart muscle. So the muscles switch to anaerobic metabolism, and that is trying to function in the absence of oxygen. Normally, the muscles work in the presence of oxygen, which is aerobic metabolism. In the absence of oxygen, it switches to anaerobic metabolism, and this produces a lot of lactic acid in the heart muscles and causes the heart to not contract effectively. If the blood flow is not restored within minutes, the heart muscles begin to die. And that is why this stage is called the irreversible cell damage. Because once these cells are dead, you cannot resurrect them. You can't bring them back to life. So, when next you think about myocardial infarction, remember that an infarct refers to an area of dead tissue. Myocardial refers to the myocardium. So, myocardial infarction talks about an area of dead tissue in the myocardium. And I hope that that will help you to remember the disease process or what a myocardial infarction is roughly all about. When a part of the heart muscle is dead, it can no longer contract effectively, and this is what leads to the deadly consequences of a myocardial infarction. This is also the reason why a heart attack or myocardial infarction is life-threatening, because when it cannot contract effectively, it leads to arrhythmias where the heart is either beating too fast, too slow, or irregular. These arrhythmias can further lead to a cardiac arrest. Then we have heart failures, which is where the heart is not able to pump effectively because a part of it is damaged. And we also have cardiogenic shock. And that happens because a part of the heart is dead. So the heart can no longer pump effectively, which means it reduces cardiac output. Reducing cardiac output means that the amount of blood in the circulation is no longer enough, and that leads to shock. Why it is called cardiogenic shock is because the cause is actually the heart. So in summary, first the plaque is ruptured, then a blood clot is formed. This blood clot occludes the coronary artery. The occlusion leads to ischemia and oxygen deprivation. Without a quick intervention, this progresses to irreversible cell damage where death of the muscles occur. Death of the cells trigger complications such as arrhythmias, cardiogenic shock, heart failure, and cardiac arrest. Why is it an emergency? I'm sure over the years or over time, you've probably had he or she had a heart attack and died. Have you ever wondered why is it that within a couple of hours, treatment or interventions are not started for this patient? They could be dead. It is because time is muscle. The longer they go without treatment, the more the area of death in the heart. And that is why treatment focuses on restoring blood flow as quickly as possible. They do things like giving aspirin, which is an antiplatelet, thrombolytic drugs like alteplase, and percutaneous coronary interventions, also known as PCI, such as angioplasty and coronary stents, to try and restore blood flow to the heart as fast as possible. If you found this explanation helpful, don't forget to subscribe for more videos on simplified anatomy, physiology, and pathophysiologies of disease conditions and systems. I can also relate myocardial infarction to its signs and symptoms as well as how it appears on ECG. Just let me know if you'd like me to make a video explaining these. If you have a topic in anatomy, physiology, or pathophysiology that you're struggling with and you would like me to explain it further for you, let me know as well and I can do that. Thank you so much for watching. Don't forget to share this video to a colleague who also needs to understand the disease process of myocardial infarction. And I hope that I'll see you in my next video.